Good afternoon, everyone. Sorry for the delay. We have some technical issues. So welcome to the 6th edition of the Public Health Research Club. Thank you for all being here today. This series is organized by the Inserm Public Health Institute and IReSP with the aim of highlighting innovative research, fostering scientific exchange, and building stronger connection across discipline and institution in public health. Today, our session will focus on evidence for action, putting health at the center of the world's response to climate change. We have the great pleasure of welcoming Rémi Slama, environmental epidemiologist specializing in climate change and health, to introduce our speaker and help us frame today's topic. Rémi, I give you the floor.
Thank you, and hello everyone. I'm delighted to be with you to listen to Marina Romanello, who's a senior research fellow at the Institute for Global Health at University College London, and very importantly, leader of the Lancet Countdown on Health and Climate Change initiative, which, as many of you already know, is an essential initiative for all of us working on the topic of the connection between climate change and health, and not only researchers, but also decision makers on this topic and for society as a whole. There are several reasons why this initiative is essential. I'll just mention a few briefly. First, a huge amount of results and indicators that are very elegantly synthesized by this initiative on a diversity of topics related to this nexus between health and climate change. Second, because these cover all essential dimensions of this nexus between climate change and health, and not only those related to temperatures impacts, which are there, of course. I would also add that, importantly, in addition to indicators on the impacts of climate change, the initiative has components related to adaptation, to mitigation, and to the related health co-benefits. And these co-benefits are essential because in the context of the climate benefits of climate change mitigation being long to come and dependent on the action of many large emitters of greenhouse gas, highlighting the health co-benefits that are often local, that come much quicker than the climate co-benefits and independently of the action of other large greenhouse gas emitters, is really essential. So putting health in the center of climate change action is indeed very relevant. And I would conclude by reminding that this initiative is very timely and highly visible. Sometimes reports, whatever the quality, stay on a little visible web page and are quickly outdated. The Lancet Countdown initiative, through its yearly updates, which is certainly a huge task for which Professor Romanello has to be congratulated, is very visible, is always relevant, and comes at a season when our northern countries do not undergo heat waves, so that a reminder about the relevance of this topic is essential for society and decision makers. I will now give the floor and listen with great pleasure to Professor Romanello. Please.
Thank you so much, and thank you again for inviting me to give this talk. I have to apologize, my computer is having an absolute meltdown, so that's why we're a bit late. It's slightly stuck, so I'm trying to send my slides through, but just bear with me a moment and I'll start sharing my slides with you. But I really wanted to thank your efforts in terms of bringing visibility to this topic, and of course, this very kind invitation. As you heard, kind of the Lancet Countdown is a big international collaboration. We bring together about 300 research institutes and UN agencies from all across the world. So our collaboration has grown really, really big. Currently, we have a global center that is the Global Lancet Countdown, as well as 6 regional centers. And those regional centers are now doing deep dives into the key issues of climate change and health that are relevant to different parts of the world. We have a center within Europe, and that Europe Center has just published a report, actually. So what I'm going to do today is I'm going to walk you through some of the latest results from our Lancet Countdown Global Report. But if PowerPoint allows me to do that, I'm going to share with you also some of the results that are relevant to Europe. So I will be complementing 2 different reports for this. And as you've heard, I'm going to be focusing on indicators, the Lancet Countdown just indicators. That is, in essence, restrictive. So what you will see is a lot of time series and a lot of analysis based on indicators, each of them one data point that we monitor across time. But what we don't do is in-depth analysis of case studies or interventions or things of the sort. So that needs to be contextualized because it's intrinsically restrictive when we talk about indicators. So when we look at indicators, what it is that those indicators can or cannot do will intrinsically be defined by the nature of those indicators. So let me share screen with you. It just worked a second ago, so I'm hoping my computer will be with me. Let's see. If not, I'm sending the link so that you can share it for me.
You can also send it to me.
Yeah, I'll just do that. Sorry, my computer is having a meltdown. I just restarted it before this meeting, but it doesn't seem to be cooperating with me today. Let me see. Won't let me do that either. Okay, let me just, if you bear with me just a second, I'm sorry again about the delay because it was just open, but it crashed again. While I try to load this, okay, there it opened. While I try to load this, I'm gonna just talk you through some of the slides, if that's okay. You don't really need to see them, to be honest with you. The information is simple anyway. But what I did want to share is that when we look at climate change and health, we hear a lot that we look at the health impacts of climate change. That is just one of the 5 working groups looking at the health impacts. What we look at mostly is what action or inaction on climate change is doing in terms of protecting a healthy future. And what we see there is our climate actions, or most often inactions, are starting to undermine health, not only by exacerbating the health impacts of climate change, but also through the unrealized health opportunities of climate action. So let me open this. Oh, I'm sorry, it's opening an old version, and I think it lost the latest edits that I had done. Okay, let me just share this with you. I'm sorry I won't have the Europe results as much as I would have liked to. I won't have the images, but I will share with you anyway the words. So in our latest report, we published it last year. The main thing that we've seen is that the health impacts of climate change have reached record new levels of threats across most of the indicators that we track. That is in line with record hot years. Most of the record temperatures observed in 2023, 2024 are reflected in the indicators, but also reflects a climate crisis that is growing really rapidly. And in the new report that we're now working with, we're already seeing the acceleration of those trends across most of the indicators that we monitor. This is leading to millions of deaths every year. This is leading to failure to adequately adapt to climate change, to harms related to fossil fuel industry and associated emissions. So, for example, and I'm sorry here, I'm missing a graph that I wanted to show you in Europe, but when we look at heat-related deaths, we're seeing this rapid growth in heat-related mortality, not only across kind of Africa that you can see there in bright red. But in Europe, we're seeing this very rapid increase in heat-related mortality. This is based on data on mortality from countries. I have to note, many countries don't generally share their mortality data, so we have to collect it bottom up. But what we are seeing is this rapid increase in deaths associated with heat exposure. For the first time this year, we're doing formal attribution of those deaths to climate change, and we see that the vast majority of deaths from heat can now be attributed to climate change. But it's also worth noting, when we talk about over 500,000 deaths annually, that exceeds all mortality from HIV or mortality from malaria, increasingly as we're seeing these deaths going up. In Europe, we're also seeing thousands of deaths from heat every year. The disproportionately affected areas, which is what unfortunately, it reversed to I think an earlier version as it crashed. But the areas that are heavily affected are in the southern parts of Europe, unsurprisingly. The south of France, glaring red. And there is where we see the high heat-related mortality due to heat exposure. But we're also seeing high levels of mortality in other parts of the world. Like, for example, in England, we see over 2,000 deaths every year. And England is relatively a cold part of the world. So is the north of France. And that is because our infrastructure is so badly adapted to high temperatures. We have built environment housing that is generally built for much colder climates. So it's designed to trap heat and not to cool down during heat waves. And as a result, what we're seeing is high levels of mortality, particularly in adult populations, those with underlying health conditions, those that live alone and don't have good access to care. We're also seeing a fast increase in wildfires. We see the wildfire risk increasing. We see an increase in exposure to wildfire smoke. In Europe, we're seeing this happening across most of Europe. The only region in Europe that does not see an increase in exposure to wildfires and associated deaths is Northern Europe. Every other European region sees an increase in deaths associated to wildfires. And the interesting thing is, in Europe, we're becoming really good at managing wildfires. So the incidence is not as high as the increasing risk of wildfires. We see a divergence there from the climate change-driven risk that is growing really rapidly. As you can see, the risk globally increased by 6.6%. And the actual impacts of wildfires that are not increasing nearly as fast, mostly thanks to adaptation, particularly in Europe. In other parts of the world, we suspect that has to do more with previous wildfires having exhausted the fuel available, so not such good news. But we are nonetheless seeing an increase in the deaths associated to wildfires. When it comes to infectious diseases, this one is particularly important for Europe. We are seeing a rapid increase in the environmental suitability for the transmission of infectious diseases. For example, dengue suitability is increasing. You can see here 2 line graphs. Aedes albopictus is the vector that is most widely spread in Europe. And you can see this very rapid increase, about 50% increase since the 1950s, in the environmental suitability for the transmission of dengue. This goes in line with an increase in the number of cases. In some parts of the world, we're seeing the frontier of dengue transmission geographically shifting further north. So you will be aware of cases of dengue increasingly reported in France, in Spain, in Italy, or in Portugal. And this correlates very well with this increased environmental suitability because of hotter conditions and changing weather patterns. And all of that, of course, is the physical damage, but we also know that climate change is also generating economic losses and economic damages. And as you can see on screen, we're monitoring 2 different things here. On the left, you can see what is economic losses associated with extreme weather events. And you can see there that the overall trend of increase in the economic losses associated with extreme weather events. And what we're marking there is also the distinction between losses that are insured or uninsured. This is something very economic, but actually it's hugely important for health, because losses that are not insured will generally fall into the shoulders of local companies, local small producers, families, and households. So uninsured losses have a direct impact on people. Insured losses can do too, but generally are covered through insurance and therefore affect the economies more macroeconomically than uninsured losses. And you can see there that fast increase, $304 billion US dollars in global economic losses in 2024. You can see that about a bit more than half were uninsured. What is interesting is when we look at countries with lower human development index or poorer countries that are most vulnerable, this is also reflected subnationally. Communities that are most vulnerable or more under-resourced generally have much less insurance coverage. So disproportionately, the burden of those losses falls on poor communities that do not have the safety net, often of an insurance. And what you can see on the right is another aspect of the economic impacts that has to do with the loss of labor productivity related to climate change. We know that with heat exposure, our physical and intellectual labor capacity drops. And that has to do with losses in labor output, labor productivity, and therefore in economic losses. This is exclusively based on exposure of workers to temperatures that would undermine their labor productivity. So not having to do with supply chain disruptions or all the other aspects of economic losses. And as you can see there, because of labor supply loss related to heat, we estimate about just over $1 trillion US lost in 2023. And again, when we look at this in terms of percentage of GDP, it's about 1% of the total gross world product or the aggregation of GDP globally. And as proportion of GDP, because of the huge burden, and particularly because of the burden on agricultural workers that incur most of the labor losses due to their high exposure, we see that it is the low and medium human development index countries that are disproportionately affected. And this is hugely important for various reasons. First, it's exacerbating the poverty gap, disproportionately affecting workers that have little access to technology, that generally have little option to shield themselves from the heat, and often on whom local food productivity and food security depends. So the loss of agricultural productivity, labor productivity in low and middle income countries or low and middle HDI countries is particularly worrying in terms of what it does to local food systems and to the purchase power of local agricultural workers and their capacity to access food and other essential health services. And once again, the link with health might not seem so obvious, but it's twofold. One, exposure of vulnerable workers to heat means that they are at risk of heat-related disease, but also the loss of income in families and households is increasingly deteriorating the socioeconomic determinants of health. Poverty and loss of access to food and loss of access to resources has a direct impact on access to essential health protective goods and services. So this definitely is of concern for public health. And I've shown you a few examples, but this is what it roughly looks like across our indicators. You can see there a heat map where each indicator is graphed in a row and where we've standardized the value of each time series with blue colors representing better conditions for health and red colors representing worse conditions for health. And you can see that very obvious gradient towards rapidly worsening health conditions across most of the indicators that we're monitoring. 65% of the indicators that I'm showing you have hash in them in the last year of data. And that indicates that that year, the latest year of data, was a record year. That is 2024, which was a record hot year. 2025 was a bit cooler, but now you will have heard we're going into what seems to be an extreme El Nino. So we're expecting these records to once again be breached. Now, it is not just the direct health impacts of climate change what is damaging health. Health is also suffering because of our climate inaction and because of all of the missed opportunities of delivering joint climate and health solutions that could greatly improve public health. And one obvious area where we see that happening is when it comes to our food systems and nutrition. What you can see there on screen is the number of, or the proportion of emissions that have to do with the agricultural sector. The agricultural sector and our general food system contributes to about 1/3 of global greenhouse gas emissions. And what you can see there on screen is where those agricultural emissions come from in terms of what we're producing. Globally, about 55% of agricultural emissions come from the rearing of red meat. Red meat is particularly carbon intensive, not only because ruminants emit methane through the ruminant process, and methane is a very high intensity greenhouse gas, but also because to grow animals, you need a lot of land and a lot of agricultural productivity for animal feed. So it's a twofold process that also takes into account those downstream demands from animal rearing. And you can see the vast majority of global agricultural emissions come from red meat production, which is a very small proportion of the consumed food. Importantly, the consumption or the excessive consumption of red meat and animal products is also linked with unhealthy diets that are excessive in red meat, carbon intensive, and insufficient in fresh fruit and vegetables are a huge driver of the global burden of disease. And we estimate about 11.8 million deaths associated with these high carbon unhealthy diets. You can see the global distribution there. Excess red meat and dairy, insufficient healthy plant-based foods are the biggest drivers, together related with high emission food systems, as well as other unhealthy consumptions that could be mitigated through healthy planetary aligned diets. This is what we also see in Europe, very similar patterns with insufficient consumption of healthy plant-based foods, the main driver of disease in Europe, followed by excess red meat and dairy consumption in Europe. So a lot to do in terms of making our diets and our nutrition healthier, which could simultaneously support also low carbon and sustainable agricultural systems. The other thing that we're seeing is kind of the energy related emissions. So anything that has to do with how we're consuming energy globally is obviously one of the biggest single driver of climate change, but also a huge driver of disease. Still today, despite huge efforts since the UNFCCC entered into force in the early 90s, the Paris Agreement in 2015, we're still seeing the world vastly dependent on fossil fuels to meet its energy grid, its energy needs. We're seeing the consequences of that now with the energy crisis related to the war in the Middle East and the disruption of supply chains, how fossil fuel prices have spiked, how access to energy is at risk because of that conflict, the geopolitical tensions in the Middle East. Is a replication of what has happened before also with the war in Ukraine. So we're seeing this huge still dependence on fossil fuels that is making our energy systems very vulnerable to geopolitical conflict. But it's worth noting that energy is an essential public health good. We know that energy is essential to refrigerate our medications, refrigerate and maintain our food, keep healthy household and indoor air temperatures through cooling and heating. It's essential to access health services that are huge energy consumers. It's essential for education and accessing information online and beyond, information systems in general, and all of those are fundamental determinants of health. So whilst we hugely depend on energy systems, it's still 81% fossil fuel based, coal still representing about 1/3 of all that fossil fuel based energy. And we're still seeing a huge gap in terms of the transition to healthy fuels. Europe is one of the countries that is leading that transition, and that can be reflected here in the percentage of electricity from renewables. Europe is leading the very high income countries in terms of renewable energy generation, giving stability, reducing energy prices. But obviously we see also huge global inequities. We see that low human development index countries, the poorer countries, often those that are more heavily reliant on dirty fuels and technologies, like burning biomass or burning dung, those that have highest levels of energy poverty. And those were about 1 billion people still do not have access to health systems that have reliable supply of energy. So in these countries where people sometimes have to deliver their babies in the dark, cannot access essential surgeries and health services because of lack of reliable energy in their health systems, we're seeing that they're still lagging in the adoption of renewables. And that is important because renewables can be accessible off-grid, are a lot cheaper in terms of the unrolling of infrastructure than fossil fuel-based infrastructure, and are not being made accessible to those communities that need it the most. So this big inequality in renewable energy access is driving a widening still of the development gap and of the health gap as a result of persistent energy poverty in the vulnerable countries. And obviously, the other aspect of energy is its contribution to air pollution. So air pollution is one of the biggest drivers of global burden of disease alongside diets, as we mentioned before. And we're still seeing levels of air pollution in most cities, over 99% of the cities in the world, that exceed the levels recommended by the World Health Organization of healthy outdoor temperature. Europe is not an exception for this. We see very high levels of air pollution across Europe. And much of this has to do with the agricultural sector that contributes to nitrates and sulfates in the atmosphere that react and produce air pollution. Much of it has to do with natural sources like dust, which is being exacerbated by drought and climate change. Some of it has to do with wildfires as well. But a huge amount of that has to do with the burning of dirty fuels, particularly in urban centers, particularly when it comes to sources like road travel, that is a big contributor. So when we look at the data globally, we estimate about 2.5 million deaths directly associated with fossil fuel burning. This is 2.5 million deaths that could be immediately avoided if we were to transition to healthy energy systems. And as you can see here, the transport sector is the biggest single contributor. As I said, liquid gas burning through transport, through road travel, contributes to high levels of air pollution, particularly in cities where people live, so exposure levels are really high. But we also see still persistent high levels of coal burning, even in Europe, still very high levels of coal burning in power plants, which is the most polluting and most inefficient fossil fuel source. So a lot still to do in terms of cleaning our air. We know that air pollution is linked to cardiovascular disease, respiratory disease, cancers, neurological disease, and cognitive deterioration, as well as adverse birth outcomes. So I'm talking about deaths here, but the burden of disease associated with this level of exposure to air pollution is perhaps a lot higher than we can accurately quantify in terms of mortality. And on the right, what you're seeing is another aspect of the health impacts of dirty fuels that has to do with death associated to exposure in people's homes to high levels of air pollution from the burning of fossil fuels, biomass, and other dirty solid fuels. And as you can see here, there's some overlap in these figures, so they're not precisely kind of additive. You cannot quite add them up. But 2.3 million deaths from household air pollution. Taking into account there the distinction between rural and urban, we see that urban households are disproportionately affected by dirty household air. This is only in 65 countries that mostly rely on dirty source of fuels in the household sector. So still death that could be perfectly avoidable by increasing energy efficiency and reducing the use of dirty fuels. And one other aspect which is interesting in terms of the damages that the persistent use of fossil fuels does to health and to well-being in general is the cost that our governments incur from the dependence of our energy system on fossil fuels. And again, this looks very economics-based, but it has huge health implications. Countries all around the world, when we're heavily dependent on fossil fuels for energy systems, resort to fossil fuel subsidies to keep energy affordable and to ensure that we don't fall into the health harms of energy poverty. We have seen this now with the Middle East energy crisis. The disruption of fossil fuel supply chains has meant that fossil fuel prices skyrocketed in the past few months. And by and large, the main reaction that countries around the world have had is reducing taxes on fossil fuels, giving tax exemptions, or directly subsidizing fossil fuel-based energy to keep energy affordable to local communities and avoid a cost of living crisis. So when we look at what was happening in 2023, this was slightly after the war in Ukraine, we were still seeing 72 of 87 countries, about 85%, that were still overall subsidizing fossil fuels. So net fossil fuel subsidies, if we take into account all subsidies and tax exemptions and all carbon pricing instruments. The net fossil fuel subsidy was still 956 billion, so almost $1 trillion, the second highest level of record after 2022, the peak of the Ukraine driven energy crisis. And we see that globally, 15 countries allocated more resources to fossil fuel subsidies than to all their health budget. So they're providing more to net subsidizing of fossil fuels. And you can see that represented here in this graph. Interestingly, for Europe, in 2023, we had a net total of over 300,000 euros allocated to net fossil fuel subsidies, again, in response to the energy spikes of the war in Ukraine. And in Europe, 12 countries allocated more than 10% of their total health budget towards subsidizing fossil fuels. And this is very meaningful. Again, it means that the national budgets are being diverted towards subsidizing fossil fuels, which harm health. It means that we are perpetuating the use of fossil fuels and making them cheaper, more affordable, more attractive because the price is lower. And it also means that those funds that are now allocated to fossil fuel subsidies could be redirected to supporting access to energy efficiency and insulation, access to clean energy, access to better health services, access to social security, etc. So a huge pressure on already overstretched national budgets because of that persistent over-reliance on fossil fuels. And now what we're seeing perhaps all around the world is a situation that is getting maybe even more dangerous, with backsliding of climate change actions all around the world, increasingly putting people in harm's way. We've seen withdrawal of funds for overnational development assistance. We've seen withdrawal of funds for climate action. We've seen increased, as I said, funding for fossil fuels. And many countries, not least driven by the US climate denier president, now backtracking on many of their commitments to tackle what could be the biggest health threat of the century. With each backtracking of commitment, the situation moving forward becomes worse. I think here we have a lot to thank France and the French government for keeping us a bit more in track and giving us a bit of hope after the One Health Summit earlier this year and all that Macron is doing in terms of supporting the climate action agenda, but we know that that balance is still very frail. And what you can see here is a similar heat map to what I've shown you before, with each indicator in a row. Worse conditions for health in red, better conditions for health in blue. But we're looking instead at indicators of action, showing us what we're doing across different aspects of our climate change actions and our climate change and health actions. And what I wanted to draw your attention to here is those indicators that have an X. That X denotes that conditions are worse than the year before, moving in the worst direction. If they were improving, then they started reversing. If they were not improving, they're getting even worse. So in 60% of those indicators, we're moving in the wrong direction. 30% show a reversal of progress. So a very, very concerning situation there. As I said, the political landscape is probably the main driver of the reversal in action that we're seeing. In the UN General Debate, we've seen that very clearly. In the UN General Debate is where countries put forward their commitments, state their positions to key issues and their priorities, and we see a really clear drop in the attention given to climate change and health, to both aspects together. Obviously, this is not good for global action and cooperation. We're also seeing the fossil fuel companies expanding their production plans even further. If you go to any of the main companies' web pages, they will have their net zero commitments stated somewhere. But beyond what they state in the web pages, when we look at what they declare to their shareholders, where they cannot lie, we see that actually they're increasing their fossil fuel production plans, and they're on track to exceeding the levels of emissions compatible with 1.5 degrees of heating, the commitment of the Paris Agreement, by 189% in the year 2040. And as you can see, that level of exceedance by 2040 is increasing year on year. So their planned production is increasingly diverting from what would keep us in line to a healthy future. They're increasingly expanding their oil and gas production, mainly because it has become very profitable because of the energy crisis, the subsidies, and the high energy prices. So while we have a global energy crisis, the fossil fuel companies are making windfall profits, and we're subsidizing their activities. And finally, we have the banks behind this. Lending from banks to the fossil fuel sector have increased really significantly. You can see there some of the key banks that have been highlighted, a lot of American banks increasing their lending, but also European banks in the mix with an increase of 29% from 2023 to 2024. Again, the return on investment and the interest from the fossil fuel sector have become huge. So it is perhaps not surprising, yet concerning. The green sector lending was also increasing really rapidly up until 2021, and you can see it's now kind of reducing, at least in the speed of increase. So while it's still growing, it's not growing nearly as fast as we need to while funds are being diverted to fossil fuels again. Now, with all of this bad news and reversal of actions, we have a lot to build on and a lot of progress that needs to be highlighted and celebrated and increased as well. And we're already seeing some of the evidence of the health benefits of those actions on health and climate change. For one, as I mentioned, renewable energy adoption is growing really fast. And that is encouraging because it's growing much faster than we thought it would. So it's not a gold solution, it's not a silver bullet. It has a lot of risks, but health-centered deployment of clean and healthy energy could actually help tilt the balance. And that industry is growing in ways that are market-led now. So they don't need political will. It's just growing with the market, which is really encouraging. It is also generating much more jobs than the fossil fuel sector. And those jobs in the renewable sector are generally cleaner, less exposed to environmental contaminants, generally, not so much at point of extraction of mineral resources, which is something that we need to pay attention to, but all the rest of the chain tends to be a lot cleaner, healthier, and more sustainable. And we're also seeing that as a result of the reduction in the use of some fossil fuels, particularly in Western Europe, particularly when it comes to reduction of coal use, we're already seeing 160,000 deaths avoided every year between 2010 and 2022. Again, showcasing how even small actions to tackle fossil fuel-based pollution can deliver huge health benefits and save lives in real time. We're also seeing some hope from local movements and local organizations, particularly grassroots actors. City engagement has been enormous. Paris is always the golden jewel when we come to talk about actions on climate change and health and how urban life can change for the better. We're seeing cities taking the lead in terms of conducting city-level risk assessments. And as we know, the health impacts of climate change are hyper-local. Action to tackle them must be local as well, particularly when it comes to adaptation. We do need cities to be closely engaging with local climate risks and deploying solutions that work for people, that take into account local realities and that avoid any potential unintended harms, both in adaptation and mitigation activities. So as you can see on screen, again, the very high Human Development Index cities, this is being led by Europe. We're seeing a lot of engagement from cities on climate action. And in terms of individuals as well, we're seeing people that despite the broader narrative, despite what we see on the news, despite very loud voices, people are worried about climate change, and people are already starting to see the impacts on them, on their family, and are engaging with the issue of climate change and health more and more. So when we look at behavior online in terms of Google searches, we are seeing an increase in the Google searches related to climate change and health globally. Perhaps what is really telling of this map is that the engagement is driven by Africa, where the impacts of climate change on health are already very severe and very obvious and very noticeable. So perhaps reflecting the graveness of the situation there. And in North America, where we're seeing this climate denialism from those in power growing, and people are starting to take notice and get interested and doing their own searches. Whether this means that there will be more engagement and support for climate action or not is yet to be seen, but at least we are seeing that there's general interest from the general community. And finally, the health sector is also one of the areas where we are seeing progress, and I hope that this can be expanded with all of your help and everyone else in this space. Healthcare emissions fell between 2021 and 2022, mostly after the COVID-19 pandemic, still accounting for a huge amount of emissions. It's still about 4.2% of global greenhouse gas emissions that come from the health sector. But we are seeing some progress there. The Lancet just published the Lancet Med Zero, that is an online database of the carbon footprint of about 2,000 different medical supplies, for us to be more mindful about the environmental impact of the supplies that we use and be able to make choices based also for equal quality of care, taking into account the environmental footprint. And we're also seeing, obviously, more and more health systems doing their vulnerability and adaptation need assessments and doing their plans for adaptation to climate change, driven no least by the WHO and the Alliance for Transformative Action on Climate and Health. So we have a lot of data which reveals the life-saving potential of climate action, reveals the opportunity to save millions of lives every year, to change our way of living for the better, to clean our environment, our air, and have healthier, more prosperous livelihoods. But we're seeing how backtracking of commitments and actions are increasingly threatening a healthy future, increasingly putting lives, health, and livelihoods on the line. But obviously, what that shows us is that protecting people's lives and livelihoods requires all hands on deck, which means action centered around health, protecting health and well-being across every sector of society, because we know that health is not just determined by the health system, but by every other sector that defines our lives. All of this work is published online. You can access it free of charge. So I do invite you to visit lancetcountdown.org. And what I wanted to draw your attention to is the policy outputs that we deliver. With all of this information that we have, often at a country level, we produce policy recommendations documents, and we produce summary data sheets that we make available to different organizations. Our policy partners help curate and co-create many of these. And we're hoping to see much more engagement in different countries. This is the way in which we summarize the evidence in ways that can be more useful at a country level and accessible to policymakers. So I do invite you to take a look at that. And apologizing once again for the technical glitches. I'm glad that we managed to make it through the slides at least. I thank you so much for your attention and welcome a few questions.
A very warm thank you, Marina, for this very inspiring and exhaustive talk, actually. Given the large audience we have, the fascinating topics you covered, of course, we would like to give the audience the opportunity for a few questions. I'll take one that is already in the chat at the level of communication, and thanks again for the huge effort in making all this accessible. A challenging question, whether you think about preparing material that would be accessible for children to explaining them these issues, or is it for someone else to do that?
A bit of both, So we have done some of that through our Europe Center, actually. Our Europe Center has published an article in, it's Frontiers for Young Minds, I think it's called. It's a Frontiers journal that is peer-reviewed by children, which are the most brutal peer reviewers They're so critical, but they're so good. So we published some of that work in Frontiers for Young Minds and translated it into kind of children accessible formats. We don't have within our team proper knowledge in terms of pedagogics or engaging with vulnerable groups, including children. So what we do in that sense is we work with other organizations for them to draw on our resources and translate it with their knowledge of how best to engage children, protecting their mental health, but empowering them as well. CAP 2030 is one of the projects that we work with, that is Children in All Policies 2030. It's a project that is based also at UCL, and they do a lot of engagement with children. What we're hoping to do moving forward is to, Frontiers for Young Minds, that's it, is to work with UNICEF and WHO's maternal and child health teams to produce an in-depth paper on children's health and translate that into products aimed at young people and children. So we're still exploring whether that is possible. If any of you is interested, we're all ears. We'd love to be able to engage with those that know how to do this well and can cater the products to children.
Very nice, beautiful, very impressive. Another important audience, the healthcare institutions.
Mm-hmm.
You have shown us many of the benefits for the general population of climate action. We have a question on whether you have relevant references and maybe indicators on the benefits of these health institutions, such as the hospitals, benefiting for the health of their patients, expressed in DALYs or whatever other way to, because these have also the challenge of both caring for the patients and also decreasing the greenhouse gas emissions, of course.
Absolutely. So it's a huge area of work and needs to be taken into account quite carefully, because you're talking about patient care decisions oftentimes, which should prioritize the good quality of care for patients. So what we're doing is we're working with another initiative based in Yale and in Canada. Don't remember the institute in Canada. That is a Lancet Healthcare Commission. So it's a commission that is going in depth into sustainable healthcare and exploring these topics in a bit more detail. They're also going to come out with a few indicators. It's been taking a bit longer than we expected, that commission, but hopefully will be published, if not in the next year, then hopefully soon after that, because they have a lot of assessment of precisely the trade-off, the cost benefits of sustainable healthcare, but also the huge health benefits of optimizing care, of not over-delivering care, which can often generate unintended harms, and on optimizing the way that we deliver care to reduce unintended harms through environmental damage, but also optimizing quality of care for patients.
Thanks. Very, very important. I have a question on the essential topic again of inequalities. You have shown very clearly the inequalities at the global scale. Is there a plan for some of your indicators? And I see the challenge behind that. I don't evaluate it. Declining some of your indicators across social categories within countries. I mean, is that realistic or?
Mm-hmm. So it's realistic through our regional centers. So the Europe Center has done analysis at a NUTS 3 level, which I wanted to show you some of the maps. I think my computer did a time slide and took me back to yesterday morning. So I prepared this yesterday evening. But we do have in the Europe report, and I'm very happy to share the link with you, a few graphs that show the difference by NUTS 3 regions, so subnationally across Europe, and you can see clear trends. Most of what we're seeing has to do with different climate impacts. So much of what you're seeing has to do with, for example, more heat in the south of Europe. We've seen droughts affecting tons of France as well, and the north of France in particular. So much of it has to do with unequal impacts of climate change. But we have some data that talk more about inequalities, that talk more about the observed impact that is dependent on local socioeconomic inequities as well. So that can already be captured in some of the indicators. What we're working on at the moment is to produce a cities report. So a report that focuses on different cities across Europe. And there is where I think that texture of inequalities will become a lot clearer as well, because we have better data for that.
Regarding the synthesis of the knowledge, is there a formal connection with the IPCC that, of course, benefit a lot from all that is done? I mean, it's accessible, so they can review it. But is there more formalism in your connections with them?
So we have a lot of our authors actually are IPCC authors as well. So we have that connection there. We are, however, engaging with the IPCC to help them with a few other bits and pieces, for example, with their indicators work, because the IPCC has a tracking mechanism. It just works every 5 years, which means that it doesn't become so helpful when you have such a rapidly changing crisis. So trying to help them to do that a bit more regularly. And yeah, we'll be very present during the review, because as I said, many of our authors are IPCC authors, but we don't formally engage with the IPCC as an organization as such.
You have alluded to even the challenge of getting access to the mortality data. And we have a question from Daniel Shemtob, our colleague from Israel and France, who is asking regarding how you manage the huge heterogeneity of the data quality regarding the infectious diseases.
Yeah, it's hugely challenging. So you will see that we have not that many, there was a review recently that said that about all known human pathogens are climate sensitive. And perhaps we track the impact of climate change on like 4 of them at most. And those are the ones where we have better characterized the impacts and we have better data because they're mandated reporting to the WHO. But by and large, even for dengue or for malaria, the reporting is so scarce that it makes it very, very difficult to assess. So generally what we do for that purpose is we don't try to attribute the incidence of disease. That would require really high quality data at really high temporal and geographical resolution. But we look at environmental suitability for a disease. So what we try to do with that is alert different regions where the likelihood of local transmission is growing, so that health systems can respond to that emerging risk and can monitor the cases or the potential import of disease as well. But it's a huge challenge. I would say it's a challenge for infectious diseases, but not only. Anything having to do with disease incidence. We all know that the global burden of disease does a bit of that, but it's so hyper-modeled that it wouldn't be sensitive to climatic changes because it's based on a steady-state model in some way. And they have a lot of assumptions in terms of climate impact. So we're working with the WHO in trying to see where countries can be encouraged to report a bit more accurately and have better data collection. One of the drivers for that work has been the global goal on adaptation indicators. That the global goal on adaptation is basically one of the resolutions in the Paris Agreement that countries will work towards global adaptation. And last year, countries agreed on a series of indicators to monitor adaptation for health. They're very broad, they're very difficult, but at least they have ignited some requests for countries to monitor the health impacts of climate change a bit better. And for that, they will need to start by collecting data better as well.
We have questions that bring us to the field of economy and political sciences, but you have touched and you are following, of course, very relevantly many economic indicators. So Marion Fiorentino is first asking whether, in terms of terminology, climate inaction shouldn't rather be termed climate destruction, or and in that regard, I would add that it's very relevant that maybe probably more transparently and boldly than IPCC, you clearly show the focus of stopping fossil fuel use, which is not always very centrally highlighted in some of the IPCC parts. And then the next question from Marion is the connection between climate change and capitalism. Marion is not defining what she calls capitalism. So, but she's stating growth and profit. So it's the question of in a way raised by the post-growth economy. Can we have or what was termed before the green growth? Is a climate neutral growth-oriented economy feasible, or do we have to get rid of the focus on climate-oriented growth? I don't know if you can touch on these issues.
No, look, they're really crucial issues, and the answer is probably the source of the problem is the way that we're consuming everything that we consume, right? So evidently the Industrial Revolution started with the issue of massive fossil fuel burning, and from there on, capitalism took over globally, and we've had a globalized world driven by overconsumption. And that undoubtedly is the driving force of what we're looking at. That is a small, very, very small piece of the broader ecological crisis, right? Climate change is just one of the aspects of the broader destruction of the whole human environment on which our health, well-being, and survival depend. So definitely that is something that needs to be addressed. Now, where I struggle a bit more with that question, and I don't think I have a clear answer for you guys, but where I struggle a bit more is what should we do about it? Because sometimes I think, well, we should be doing what we can do and as much as we can do to fix the problem as quickly as we possibly can. And if we try to tackle capitalism, we're probably against a losing battle given the powers that be. On the other hand, if we don't address it at its source, can we succeed in the broader ecological crisis? So I think it's almost a kind of strategic / philosophical question of what is the best approach forward. Conceptually, absolutely agree. Capitalism, overconsumption, the growth economy is a problem. Can we envision another economy that is built within planetary boundaries, in which growth can still perhaps happen, but not in ways that sacrifices our natural environment? Can that be done realistically in the timeframes that we need it to have done? I think that question is about my pay grade, but I think that is the key that we need to resolve. In our request and our engagement with governments, we see that every time we drop the word capitalism, there's a silence in the room and everyone wants to escape because no one really knows what to do with it. So I think our approach so far has been to start giving solutions in terms of things like energy efficiency or more mindful consumption and trying to bring it down to more manageable pieces.
Thanks. This is a huge topic on which certainly we need to continue the discussion. We go more on the question on the new technologies and in particular their implementation in low and middle income country context. Is there evidence that actually these new technologies are being used in these contexts and are part of the solution?
Yeah, look, they're brilliant examples. They're absolutely brilliant examples. And I can give you two that to me are spectacular. One is in Nepal. Nepal is a country that, sorry, not Nepal, Mongolia. Confusing. Mongolia is a country that is extremely cold and where people still hugely rely on coal to heat their homes, often used indoors in households. There's a private company that was started. It started as a charity, but it became an actual company now, where basically the main driver was seeing that the lung capacity of children in Mongolia was reduced by 60% of the capacity of a child elsewhere because of exposure to coal-related household pollution. So this person started to develop an infrastructure of providing access to renewable energy, mainly using solar panels, and started deploying solar panels across households in Mongolia. And he showed me some of the preliminary impacts of his company and the lung capacity of children. It already increased to 80% in the families that have already started adopting these technologies. The change is impressive. And it basically had to do with the government not acting fast enough. And this person saying, well, we'll take a a market-based approach. We'll make these resources available. We'll try to deploy them at scale. We'll develop the supply chains, and we'll give access to energy. The main barrier there is when it comes to cooking. I think that's where we draw the line globally. It's like, well, we like our food tasting like wood. I'm Argentinian. We do a lot of barbecues based on wood. That is something that people really struggle to shift away from. But perhaps it's not about completely obliterating your costumes and your heritage, but actually saying, well, we'll do that wood cooking maybe once a month, once every couple of months. We'll try to tune it down a bit because it's harmful. And that is one of the brilliant examples. The other brilliant example is actually being driven by IRENA and WHO and a few others. That is in terms of providing access to electricity in healthcare settings, in LMICs, where they don't have reliable access to electricity. So remote healthcare facilities outside of energy grids generally rely on local generators based on diesel, hugely contaminating, really, really polluting, loads of black carbon coming from diesel. And also very expensive and very unreliable, because if you couldn't purchase or bring the fuel with you, then you don't have electricity that day. So they've been doing a huge project of electrifying healthcare facilities through solar panels and wind turbines, particularly in sub-Saharan Africa, with dramatically changed the quality of care locally. In Haiti has the biggest hospital that is mainly reliant on solar panels. And the reason they did that is because they were having so many power disruptions after each subsequent hurricane or extreme storm that they couldn't operate. So the solar panels allowed them to bypass the energy grid to have local access to electricity. So definitely, yes, very, very good examples of access to new technologies in LMICs.
Thanks a lot. It's very nice. I think we can conclude on these very rather positive examples of solutions that are being used relevantly in low and middle income countries. I would like to thank you very warmly once again, Marina, for not only this talk, but the very, very inspiring and useful work you are doing, leading this huge undertaking of the Lancet Countdown and health and climate change. We rely on you to help us disseminate and synthesize this essential knowledge. Thanks again, and a very nice afternoon to you and everyone.
Thank you so much. Thank you for this opportunity.
Thank you again.
Thank you. Goodbye, everyone.
Thank you.
Bye, everyone. Thank you.
Bye.
Bye.